Hi, I'm Joshua Pangan and I'm a third-year nursing student. Today I'm going to be demonstrating how to administer an IV continuous infusion and also a chest dressing change. So first I'm going to do hand hygiene before coming into my patient's room. I'm going to walk in. Hello, Mrs. Wendy Holmes. I'm Joshua. I'm going to be your student nurse for today. I'm just going to check your armband. Can you state your name and birth date for me? Wendy Holmes, and VIN number is 123-123-456-789. So I'm just going to do an initial safety check. And since she has a chest tube, we want to ensure that Mrs. Holmes here has her head of bed at a semi-fowler's position. So, Mrs. Holmes, right now I'm going to be starting your heparin infusion. Heparin is an anticoagulant, it's a blood thinner. And if you're experiencing any unusual bleeding or anything like that, just please notify us. And if you also feel anything unusual, just use your call bell. Okay, so the patient does have a right to refuse this medication, but since they didn't, I can go ahead and start my administration. So here I have my MAR. And since the medication was already prepped and hung by one of my nurses already, I'm just going to do my first check. So, right patient is Wendy Holmes. This is Wendy Holmes. VIN number is 123-123-456-456-789-789. Right medication is Heparin VTE, venous thrombosis, and here I have heparin. Right dosage is the 25,000 units in D5W, and this is 25,000 units, and then this is in D5W as well. And right dosage, right route is IV, and right time and frequency is now. So I've got my right patient, right medication, right dosage, right route, and right time and frequency. So I've done my first medication check, and now I can just input it. So I'm noticing here that my carrier solution is running at TKO. I'm noticing the drips here. And it's enrolled, and that it is normal feeding. So now I can just hit primary, since it's going to be running through my primary line, and hit primary here, and I'm going to use the colleague guardian. Now this is for heparin VTE. Can you see it?
Yeah, just the glare.
So here, heparin VTE, I'm going to select it. Now this is drug amount, 25,000 units, diluent 250, concentration. The dose, as stated in my MAR here, is 1,350 units per hour, 1,350. And it's going to be, and as I calculated it before prior, it's 13.5 milliliters per hour. So before I confirm anything, I'm just gonna do my second check against my MAR again. So right patient, Wendy Holmes. Right medication is heparin, and here I have heparin VTE, and its right dosages is 25,000 units, dextrose injections 25,000 units, and it is 1,350 per units per hour. Here I have 25,000 units, 1,350 units per hour, and it's running at 13.5 milliliters per hour. And right time and frequency is now, and right route is through the continuous IV infusion. So I'm going to go ahead and attach this to my referral IV here. So I have ensured that my line is primed, as stated. So I'm going to clean this for 30 seconds, let it dry for 15, throw that into the garbage. And I'm going to attach this, maintaining sterile technique. So here we have seen the bleb to ensure that it is primed. So before I actually confirm primary, since this is a high alert medication, I'm just going to get a second nurse with me to do my third med check. And the way we're going to do the third med check is the same way that I've done my first and second medication check. So my second nurse has confirmed already that my rates are correct, so I can go ahead and confirm my primary. And I can press start to begin. And I'm going to ensure that my 3 drips are running.
Again, do my second check, make sure I have everything right. So, right rate, right, 18,000.
So I've ensured my 3 drips are running. And now I would just monitor him since this is her first time receiving the medication, looking for any adverse effects. So, Miss Wendy Holmes, right now I'm just gonna, if you got your heparin started, I'm just going to start your chest tube dressing change now. So before I want to get into chest tube change, I'm going to ensure my safety checks are there. So for safety checks, I want to ensure that the 2 clamping forceps are there, as well as extra normal saline or extra sterile water, which I have here. Now, when we look at the suctioning, we want to see that it is connected properly here, that it is on, it's on, and that it is at, and that it is continuous low, so within the green. So we see that it's on continuous low.
So since this is a high alert, I'll make sure to get a second
There.
to check this as well.
Now, when we trace this here,
I've already done my label. So
can you come with me, cameraman?
R, so hemoglobin R.
We want to see here
I need to do
that it's connected properly. Now, I'm going to start from up here. So I'm just going to check your dressing change here. Can you lift your arm for me, please? So this is the position you would want to get them in if they are, if you are doing a dressing change, just so that they are able to get a good access and there won't be interfering. So when I'm palpating this here, I'm just going to check that the dressing is dry and intact and that there's no signs of pulmonary emphysema. I'm going to trace it, making sure to look at the tubing, that there's no kinks, clamps, or leakages, and that there's no clotting within the tubing. I'm going to trace it down here, ensure that there's a safety clamp there. And then when I hit to the drainage system, I want to see that 2 centimeters of water is there. And since this is a dry container, or the dry system, I don't need the 20 centimeters of water. I want to see that my orange ball is visible and that my suction is set at 20 centimeters of water as well. I also want to note the amount and type of drainage in our system, and I want to mark that at the start and beginning of my shift. Now, when we look here, we see that there's quite a bit of bubbling. Well, lots of bubbling. What we want to see is like a nice, like close to no bubbling at all, actually. But this is jacuzzi bubbles, so that tells me that there's a leakage within the system. So when we're assessing for leaks, we would want to use either 2 clamps or 2 butterfly clamps, or if you have none, you can use your fingers as well. So you would want to start by clamping closest to the patient here. So when you clamp that, and you're going to assess your drainage system again to see that if the bubbling has stopped. Now, if you clamp there and the bubbling has stopped, it could be indicative that there is a leakage within the patient. We would notify our physician. But otherwise, if there's not, we would continue along the line till we notice, in segments around like this length, till we notice that bubbling has stopped or not. Now, when you're clamping, you also don't want to go greater than 15 seconds, as that could be a risk for pneumothorax. So I'm just going to put this back here. Okay, so I've done my safety check. So, Ms. Holmes, I'm just going to go ahead and start on your chest tube drainage. So I'm just going to
supposed to be wearing gloves and masks.
chest tube drainage. So I'm just going to lift your head here, and I'm going to set up my field.
like the rail should have been up.
So what you will need is you'll need gloves, you'll need a couple drainage sponges, 4x4s, your Jello net, and normal saline. So I'm gonna use this as my garbage here. Can I put this on you? Thank you.
I make sure that like the suction is working.
So, maintaining sterile technique, I'm just going to go ahead and open
It's at the right rate and that it is on correctly. Everything
feel
works.
here.
Make sure that
I will check that. If I'm holding it.
Ensure that my blue forceps are sterile as well. And I'm just going to move this. So I don't really need this right now. I will just toss that there. So I don't need that. So I'm just gonna put out my forceps tip to tip.
So for the sake of the video, I'm just gonna have everything closed, just because it's
Tip to tip.
if the suction's not working, we'll get
So now I can just put in my normal
I'll
saline.
be doing a straight dressing change today. So first, I'm just going to get you to take a few big deep breaths, so like 2 or 3 deep breaths, and you've done
My
that.
Jello net.
And so now we are going to. Sorry, before I touch the hand, I'm just going to do hand hygiene again.
My drainage sponge. And also another 4x4 in case I need it, which I'll probably just put in there. I'll also need Meafix, so I'm going to ask my camerawoman to get me 2 Meafix, please. So I got my Meafix here, and I would also I'd also date and initial these. So first I'm gonna start off with putting on some gloves.
And we do -2
Right, I also
multiplied by
need to
2,
make
so
sure
that would
that
give us
like
10.
the
And that
oxygen
is
is
10
correct, so
French.
is on.
And so make sure not to touch.
And I'm gonna start by
I would
taking off
clean it.
this.
Just for the purpose of this video.
So this is going to be stitched, so I'm just gonna ensure.
And making sure not to touch the 5 to 6 inch at the bottom. And I'm not.
And I'm just
going
gonna
to
still
apply
ensure that it
suction.
doesn't accidentally get pulled out.
Yeah. So,
So when I take that off, I'm just gonna assess my drainage if there's any unusual amount of it, or if there's any certain colors that I don't need or like. So then I'm gonna go ahead and take my blue forceps here and take off the Jello net,
that is -2 times to the size. So I get like a size.
and I'm gonna dispose of it all together. And I'm gonna change my gloves. So here I'm assessing my wound, making sure that there's no signs of infection like inflammation, redness, and that it is
And then I ask my patient,
nice. The surrounding wound is peachy and nice. So I'm gonna put on these gloves,
right, 1, 2,
and I'm gonna start cleaning my wound.
Good. So now we'll proceed with the suction. So like I said, I should be wearing a mask, but just for the purpose of this video.
I'm gonna grab 2x2,
And so I'm
Open up.
wet that a bit, and I'm gonna do 1 swipe per wipe. So
That
clean.
like I keep
Discard.
5 to 6 inches rather sterile, and then anything above my hand here will be unsterile. Okay, so we're just
would be
gonna
wearing
go
gloves
with
and
One swipe per wipe again, a bit outer this time,
I will not be wearing a mask.
and
I
just another time.
like where I can't go in any further, so I'm gonna twist it a little bit and suction on
Out again.
So
Now I'm just gonna dry it with one of my 4x4s
the
here.
suction should have been suctioning at 85 to 120. So I'll do that now. So I'll just change my catheter. So this one should be wrapped in a glove and then
So
disposed.
there. I've dried it,
So the suction is just
and I'm wanting to go grab my Jello net now.
5 when I do this, so that's still good. So I used size 10 of sterile suction.
And separate that.
Open this.
So now I'm gonna want my gel net.
Right, so prior to this, like I would have done like what I did earlier, like pre-oxygenate.
Now,
So I keep 5 to 6 inches.
just want to twist it around to get good in here. And I'm gonna apply it around.
And then suction on my way up. Make sure I only stay for 10 to 15 seconds. Good. So this one I will wrap around my glove. Move it. Then I will
And make sure that it is occlusive.
our water until it runs clear. So this is clear now.
Okay, good. So now I can apply my drainage sponges here.
Then I'll put a clean glove over it.
So one in one direction,
So I will be doing this, so no touch. I'll change my gloves, or you can do it with the.
and another in another direction.
And so first, I will just remove. And then I will note the drainage, how much is on it.
So then I can grab my 4x4s
And then I'm going to be changing your tray dressing. I'm just going to get my stuff ready.
and put that on top of my drainage.
Patient's not in a spot for distress.
So then I just want to date and sign my me-fix tape too. So here I have whatever date it is and my signature.
And so I would have my
You know,
so it's just be normal.
put that last.
Just do one swipe below. Into the garbage.
Here.
Making sure to stabilize it and then using it above. And then I'll just be cleaning it with
So I dropped my porcelain.
There. Make sure that it is
Grab.
occlusive. And I'm gonna grab my other one.
and then one at the bottom. Drop it in my field. Garbage.
But I'll grab another one.
And make sure to tent it
So I'll just hold it by the
so that if it pulls, if my patient pulls on it, it's pulling on the dressing and not him. And this one.
as fast like I wouldn't be using.
So this is just
So my signature and date is visible as well. Afterwards, I return my patient to the usual set and do my exit safety check and
Good.
I'll be